And if I don't pick up on it right away, I have 3 screens to try to do this training, so I may or may not see it. But go ahead and just interrupt me and just call out my name, and I will stop talking and we can answer that question. Does anybody have a question as of right now? All right, I hope everybody's awake this morning. We had a pretty quiet group last night, so I hope you guys have some questions for me. And if I do go too fast going through these topics, please ask me to go back over something if I did go through it too fast for you. So I'm going to go ahead and share my screen here. I do have some stuff already set up in our live environment, but I'm using a test patient. And if somebody can acknowledge when you see my screen, that would be great.
I see your screen, John.
All right, thank you very much. So I'm going to go ahead and start with Message Center. Dr. Sharma brought up a point on Message Center to go through a message, or you can even go through orders and stuff like that and open up a patient's chart within these messages or orders. As you can see, I have actually done a couple test orders and along with a message, but I'm going to take the first one and I'm just going to go ahead and open it up, and you can view the details of this order. Now, some people may or may not know this, but you can open up the patient's chart from the summary view link. There's also another way you can open the patient's chart up, but you'll end up having to close it. You're going to notice that their patient's name is located there as well for this ZZ test, Corinne. So I'm going to go ahead and use the summary view. So you can open up this chart and view specific components of this chart, their home aids, their documents, vital signs, and so forth. And you can scroll through these and view this chart. And then if you want to go back to your message, you can just go right back to the inbox. And for here, I would just simply OK, next, and approve it, and it will open up the next message, and I could continue on. So it's kind of a nice way of going right into the chart, reviewing anything before you sign off on orders or complete a message. The Message Center messages works the same way. You open up a message, you'll notice that you have the summary view, and you can actually launch orders directly from this message. If you launch an order from a message, it will embed those orders within the message, so you can reply back to the MA or your nurse to inform them that these orders have been placed. Any questions on that? Okay, so I'm going to go ahead and talk about adding a link to our toolbars that we have up here. We do have Dynamed, and some providers do have UpToDate as a link. You are allowed to add 2 external links to this banner bar up here, and you can simply right-click anywhere in this banner bar area, and you'll have the customized link open up. And from here, you simply want to select Add and enter in the name that you would like displayed. I'm going to do CDC. And I know their URL. You could simply copy and paste if you do not know it and you did a search for it. And then simply select OK. And now you're going to notice that it is added up to our banner bar. You can just close the window and it will stick, and it'll take you straight to CDC, which is kind of nice, so you don't need to jump out of it and do a Google search for it. And you're allowed up to 2 links from that. So I'm going to go into a test patient from here. Any questions so far? All right, so I'm going to use Corinne, and there are some stuff in here that's missing. Unfortunately, I don't have some diagnostics because I do want to show you how to tag some impressions and to pull it into your note. But I could talk to you if you do have a question regarding that. But I just wanted to go over new order entry. Some providers have been around here for a few years, and it's been about 4 or 5 years that we started, Cerner has come out with these M pages. And so some providers work off the table of contents or the menu bar on the left-hand side. And if you are still that person that goes through the orders to get into placing orders, you can still do that. This is just new Cerner functionality. If you were to come to an ambulatory class in the last 4 years or so, you'll see this functionality. But new order entry gives you an opportunity to see your home page that you guys see. You'll have your favorites. You have public folders, which is your default to your home. And from this functionality, you can actually share and copy other providers' orders from here. So if Dr. Sharma had an order that you wanted to copy, and you can just do a search for her name and pull that in. But I do want to show you guys how you can create folders, subfolders within these your favorite folders. Right now, I just have a couple of folders in here, and I'm going to go ahead and show you how you can create your special folders from either the ambulatory meds by RX or your in-office meds folders. What you'll do is you can either go from the new order entry hyperlink or from your orders on the table of contents. And I use our new order entry. I'll take it to this display. I'll simply select add and select yes. Now here you're going to have your default home view here, and you're going to have your favorites, and then right next to favorites there's a little drop down arrow. If you click on that, you'll be able to organize all your favorite folders. You'll have an organized favorite window display. And then you want to start with a hierarchy of favorites. If you start with the ambulatory in-office one, you'll make a subfolder. So I'm going to start with the top one, and I'm going to create a folder. Just name it as wish. And if this was going to be a DI, I wanted to rename it, I could do that. And then I could make simply a subfolder if I wanted to. And I could break these down even further into subcategories. And you can place those orders specifically within those if you would like. And you can go as deep as you want on subfolders. Just remember, once you're done, you just simply close it. Now this one I did made the subfolders under the ambulatory meds by RX. And if you want to make folders within your in-office link, you could simply do the same thing by selecting this one, going back into the drop down and repeating the process that I just did. And you'll be able to see this one from here. Any questions on that, on how to make a subfolders?
Joe, can you also show how to add items to those folders if somebody wanted to add a CT hub to their folder?
Yep. And so now you notice I came back to my home screen where I'm back to the meds RX, and I can come over to my favorites folder, and you're going to notice that I have these built out here, DI and my subs. So if I'm looking for a MRI order, and I'm going to select the little opaque star, create folders, and then I could go all the way down into those and add those. And you can do that with anyone. If I just wanted a lab, and I did not create a folder for it, so I'm just going to go ahead and drop it in that favorites folders. And then as I come back, you're going to see the CBC lives outside of these folders. And under the DI, I go down to MRI, and I have my MRI. Please be aware that if you do create these favorites and you have a blue star here, that you do not want to select that blue star. It will remove that order. And if I come back and refresh it, I come back and try to find this order, it is gone. Where there is a weird little glitch with our system here, if I come back into my folders, you may still have it within here. And I'm actually working with our department to try to find these orders. So yeah, so they actually fixed it. So this was still saving them, but it looks like they did clear it up. So please be careful when you create a favorite order that you do not select this blue star. It will remove the star, or remove that order, excuse me. Any questions on the favorites folders?
Would it be helpful to have a quick demo about how you can see other folks'
Yep.
folders?
Yep, that's what I was just about to do next. And what she's referring to is shared folders. So Dr. Sharma, I'm going to use you, if you don't mind, to look at your orders. So you select share, and a lot of providers will come right back up to the search function and start typing the provider's name. It actually is in this search field. So a lot of people don't realize that this little window opens up. So and find your provider, and you'll be able to see that she has some folders that created for her. And I could open these up, and she has a bunch of subfolders within these. So if I go to referrals, if I wanted to pull these into these orders, oops, I actually clicked and ordered one. And I can simply select a star, and if I had appropriate folder, I could add it to that. Now I could go back up in here, and I do want to talk about, like this is a generic power plan order, and I'm just going to select the star, and I'm going to save it to here. Now I'm going to look at her plan favorites, that she has some specific power plans that she has modified herself. And you're going to notice that there's no star next to these because Cerner wants you to review these before you create your own um, favorite. So I'm going to go ahead and just grab a diabetes, and I click on it one time as if you're going to order it, and it goes up to our orders for signature. It's kind of like shopping online and you're placing orders for stuff. It goes up to a cart. It's the same functionality. It just goes up to here. And this orders for signature window displays. And what's really nice about this is where you can actually select your diagnosis that's associated with these orders up front. If you do not do this and you could try to sign this off later, you're going to have to do it on the back end. So here, this patient has asthma. If I had diabetes in here, I would select it and I can have a 1. If you had multiple problems that ran across here, you can go 1, 2, 3, 4, and stuff like that. If I was to sign this order or modify it in this phase, it will simply take me to the same location. And so here she's actually has a power plan that's been modified through our IT department. And this is just a notification that it's been modified. It'll tell you what the changes were. And here what we want to do is select continue. Continue will actually save or open up the power plan with all of her saved options in it, all her boxes checked. If you select load standard plan, it will wipe out anything that she's modified and load just the basic plan. So you will not see what she's done in that specific power plan. So please remember to select continue. And once you do that, you'll want to go ahead, and when you save it, you will not have that pop up anymore. And so through here, I could see her power plan and I could review anything that she has selected in this order set. And it looks like she has just saved it as her own with no options here. And so what I'm going to go ahead and do is I'm going to go look at a couple things and just add to these if these are going to be my order set. And once you're done selecting the appropriate orders within this power plan, you want to save as my favorite. And this is where it will become your own order. And you can rename this if you like. Some providers will put their initials behind it so they know that this is their order and not somebody else. And so they'll simply select OK. And here I'm going to go ahead and cancel this order. And I'm going to go back to our favorites, and you'll be able to see these ones in your My Plan Favorites folders. And you're going to find it here in my diabetes. The one that I saved one here is this one right here. And just remember the same functionality here is that if you happen to select that star, it will remove it. So please be careful on doing that. If you need to order these power plans from this view, you simply select it. You're going to have a little blue bar up here. Depending on your contrast of your monitor, it may be a really dark blue or a light blue. And then you just come up and place your order, associate the problems and diagnosis. And if you, like I said, if you even sign or modify it, it'll take you back to it before you can sign off on it. Any questions on how to copy a provider's set of orders? Okay, so if you do want to review any orders that are out there on this patient, we do have orders profile, and this will give you all the orders that are in a active status. We can change this if you want to see anything that's been completed or anything by simply selecting the drop down and go all orders, all statuses, and it will display everything here. And that's a nice way to find out if anything's been canceled or completed, and you can scroll through all the order sets. I'm going to go back to all active orders because from here, I want to show you how you can actually cancel an order if you've ordered it and it's not the correct order and you want to completely remove it, or if you need to modify it and reorder it. Instead of canceling it, then going and having to find a new or re-enter the order, you can simply cancel or remodify it. You're going to notice we have two CBCs here, so we have a duplicate. I do not need both of them in here. I'm going to go ahead and remove one. You simply select the order. You have a viewing pane on the right open up, and you have that cancel DC, and this will completely remove this order. And I'll show you how to cancel and reorder in just a second with another one. So simply select the cancel DC. It goes up to your orders for signature box to sign off on, and I simply sign it. And you're going to notice now it's completely removed. Now, if I needed to change an order set for whatever reason, like these are routine labs, I'm going to go ahead and dispatch these as a stat order. Make it a simple one. I'm going to select the order here. I'm going to go to cancel and reorder. It goes back to my orders for signature box. I'm going to select modify because I do want to modify the original order set. And you're going to notice that the CBC, the original one, is now lined out. I'm going to select the new one. And here you're going to have your details for this order display. And here I could just simply change it and then simply sign off on this order. And now you're going to notice that this is a stat order. Any questions on the order profile?
Are the cancel lab orders translating to an order to LabCorp as
It's
the lab was canceled?
once it's canceled, yeah, it goes off to wherever it's at. If you guys have it in-house or going to LabCorp, it gets canceled and it's sent off to LabCorp, for example.
Great, thank you.
Yep. So I'm going to cover home medications, and on this view, you'll be able to see the patient's medications they're on. Obviously, we see two prescriptions, and we have a historical medication that this patient's taken, a lisinopril, and now we also have a prescription. And talking with Emily, I believe is a lot of patients have a lot of meds that need to be cleaned up on their patient list. And I could show you a very easy way when you're sitting with your patient and you're going through their med list and how to remove these if they've completed their meds or they're no longer taking them and you just want to completely remove it, or even if it's a wrong order. If you've placed it, you could come in here and say, oh, it's the wrong one, and cancel this order. You guys do your med rec. Hopefully you guys know this option of going out through the outpatient. You're going to notice that the check mark means the nurse or the MA has done their med rec, and you are able to complete your outpatient med rec. Simply select this little link. It will bring you to our reconciliation page, and you're going to notice that our lisinopril, they want this patient to continue after this med rec. Now, if I wanted her to stop taking this one or even this prescription, simply mark the little or do the radio button under. If you hover over these, it'll give you an example what to do. And I want this patient to stop taking this one, and they'll continue this one. Now, naproxen here, if I wanted to do anything, if I right click, I could reset, I can add a modify compliance or order information and review these from here. Now, if I wanted to add another medication to the patient's, I could simply come up to the add, and you just go through your normal process of ordering a medication. And you're gonna notice that now it's gonna be a prescription. And my start and stop date, I could do the math and try to figure out how many days out, or if I go to my duration, I can simply select my duration and it will populate my stop dates on these. And then once you're completely done with your MedRec, you can reconcile and sign these. And once you do that, you'll be able to see that you have a check mark on yours. And anytime if you do this and you need to go back and redo something, add another prescription, you can come back at this at any time and add from here, or you can do it through a simple new order entry or order. Any questions? And you'll notice that that lisinopril is no longer on their MedRec. All right, so I'm going to go, and Emily just asked me just to kind of show you guys where you can find some screening, your questionnaires, all your numbers here, is that the defaults to your last 13 months. And from this little drop down, you'll be able to see the depression screening numbers, and like the mini cog numbers will display in here from the documentation from your MAs in this component. And you can look back 2 years and 5 years for these as well.
Do these trend like the labs do, Joe?
I'm sorry, what was that?
Can you trend these, get that graph?
Oh, from here where you look at it, it just gives you the values. It will not show you a graph. But that's a very good question, and I'm going to make a note of that to see if we can get Cerner to do a trend with that, like what we see in our labs and our vitals.
Right.
Okay. So I'm going to go down and we're going to talk about documentations or documents and how to view some new functionality within documents. I'm going to select the documents component. And you're going to notice that I have a document in progress where I've started one and I've saved and closed it to finish it at a later date. I do want to point out that you're going to notice that I started this document yesterday at 6 o'clock, and I do need to complete this one. I'm going to open this document up and continue where I left off. And if I need to add anything, I could simply go back and add it. Now, I have a couple labs already added to this document, and if I realize that I wanted to review some more labs and pull more information in here, or I forgot to tag custom micro, I wanted that in here or anything else, I can go back in and into the patient's chart by simply going to this little back arrow is the easiest way into the patient's chart. And I'm going to go up into labs, and I'll go over how to tag these again in a second, but I just wanted to show you the functionality of how you can go back into the patient's chart. So I'm going to take the whole chem panel here and add this. And then I'm going to go back to my forward button, and it opens back up into the chart. And I'm going to go up to my labs, and I will refresh this. And it pulls in a little bit more. It should have pulled in my other ones. But once you are done completing this document, now I started this document yesterday, and if you are working on this document the next day, you do need to have to go back and change the data service. If you do not, HIM is going to send this back to you to change the data service, and it'll have to be an addendum. So from here, I'm going to simply go back and change it to whatever date I needed it to do. And so actually this one's stuck on the 11th. Usually I don't know why that did that, but it went to the 11th. And this is how you can backdate it and change the time. And simply sign that document. And I'm going to refresh this component. And now you're going to notice that this has been completed. I think our system was being a little slow because I changed that to 11th and it didn't stick. I do want to show you how you can do continuous scrolling through these documents. You're going to notice that these are showing all completed documents, and we do have some other filters here. If you change your filters, if you're looking for op notes or cardiology notes, simply change these filters and select apply, and we'll pull up those specific notes. You can also group them by encounters if you like, but if you do want to view a different type of note, please remember to come back and recheck it. Now, this person does not have any op notes at this time, and your clinical documentation is the hierarchy. Once this one's selected, all these note types should populate underneath this document hierarchy. And these are defaulted as last 50 notes. You can do your notes only if you're just looking for ones that you've completed, or you can group these by encounter, and it breaks them all up by their encounters. And when I mentioned about continuous scrolling, I'm going to review all these cardiology notes. And instead of selecting one and having to go through this note, and once I'm done reviewing this note and closing it and opening up the next one because it was not the note I was looking for, if you select I'm just going to use the top one to do this, and I'm going to select this little box that's up here on the right before you close out this window. You enable the continuous scrolling, and once you select this little box, it sticks. So if I close out of this application and come back tomorrow, this will still be checked. So what this gives you the ability to do is just scroll from one document to the next. And as I go through this one, I'll find the next document. It's a big document. And so then your next document is right here, which is this one at 646, 647. And I could continue on down and review these documents. And I find the next one at 645 and so forth. You can continue on down through these. Any questions on that little functionality or viewing documents or anything? Now, before I go on and show how to tag components or text from documents, I do want to show you another little function of filters of documents. You can go through your documents link here where it says 43 for this patient, and we'll bring you over to clinical documentation. You can simply select clinical documentation from here as well, but I'm going to show you how you can create your own subfolder within this application here. It's defaulted to all, and you're going to notice that I have a custom procedure one already selected, and it shows my colonoscopy. So if I'm specifically looking for colonoscopy ones and I do not see it on the other documents, these three little ellipsis dots, you can simply select this, give it a second to open up, and you're going to notice that I have this one already selected for colonoscopy, and it pulls those note types in. And I can simply select a new one if I wanted to, and it'll start all over. And then I could title this one up on top as a test. And I'm just going to look at H&Ps, or if I want to go surgical procedures and look for my colonoscopy one here. Select a couple of these and then simply select apply if I'm done. Now you can set some filters in here. I'll look back at how many years you want. If I wanted to go back 2 years for these can be, I can select for authors and stuff like that. I can restrict these note types by physicians only. And you can also restrict these as well. If you go into this filter, I would strongly recommend reach out to Emily or somebody with informatics to show you how you can do this, because you can go pretty deep in these folders and create a lot of work for yourself that's unnecessary, because there's a bunch of subsets in these. So be careful when you start trying to create a custom folder. But once I'm done, I'm going to simply select apply. Yes, I'm going to say yes. And that one didn't pull them in, but it should pull in. I think I modified this one by mistake. And you can go back and edit these. These should have pulled in my documents. I don't know why this is not working for me. It figures it would do this to me, but I did this procedure one last night and it worked just fine. So here I could go back and view these documents. You can go in here and make multiple different filters if you wish. It's very unlimited to do so. And if you need to remove one, you can simply remove that folder. Any questions on that? Okay, so I'm going to talk about how you can tag um, and use contextual view or split screen. Some people refer to it as that. And with labs and vital signs. So depending on how your view is, I move these components so they're specific to this little training session. But if you wanted to review labs and bring in specific labs to your documentation, you can simply select the labs component and scroll through your labs. And you notice that I did the ones earlier for a document. You could do these by individual ones. You can select a random lab results. For example, these are all low and a critical or a high. If I just wanted them, I simply hold down the control key and simply randomly select these. And you're going to notice that I have some other labs already tagged on these, and I'm actually going to clean up these tags. Sorry. I'm going to remove those and start this back over. So I'm going to open up this first one, scroll down, and hold the control key down. And I have my 3 results, and I will tag those. Like I said, you can do individual ones. I'm just going to do one at a time. Or if you wish to grab the entire panel of these, I'm going to select one of them, and then I'm going to scroll down to the bottom one, and I'm going to hold my shift key and select all of them, and then I'll tag all results. Now, if you did tag the ones that you've tagged earlier, it will not duplicate these tags in the report. It overrides them, and so you will not have duplication. And these will auto-populate into the component in the document. And I'm going to close this little window. We talked about how you can see a trend on a patient's results. And on this patient, I don't have a trend. I'm looking to see if I have multiple ones here. But if you do select the type of result, and if there's multiple ones, if you click on cholesterol, you'll see a trending graph here on these. My apologies, this patient does not have multiple lab results. Actually, here, we'll do this one. This one will show you the negative results because it's a document or it's in text. But if you have these in as cholesterol, if you wanted to trend their cholesterol, you would actually send a trending graph here. And I'm going to go to our vital signs, and that function works the same within vital signs. As I select the BP, you'll see the trending graph here, along with if you wanted to see the respiratory rate or their O2, you can see a trend. And this is how it would display within our labs component as well. Now, I do get asked if you can tag vital signs results. You cannot tag them at this time. There is an option where we can put in a request to see if you wanted the last 24, 48, and so forth. If you do want a series of vital signs, please let us know, and we can see if we can create a auto text or something like that to pull it in. Any questions on tagging the labs?
I just have a quick question. When I tag labs using the shift bar, I often get an error message, and I'm not sure if I'm just the only one that happens or if I'm doing it incorrectly. Do you know anything about that?
When you do the shift, when
Right.
you hold,
So I click at the top, I click shift, and then the bottom where I want it. When
yeah, it
I often
should.
get an error message right there.
Really, can you do me a favor? If you get that error message, can you get a screenshot of and send that to Emily, let her know?
Sure.
But you should not see an error message at all. You may see a refresh where they want you to refresh, and that's just Cerner has got a little glitch and it needs you to refresh, but you should not see an error message at all.
Okay. Thank you.
Mm-hmm. Any other questions on tagging? So I'm going to go down to documents, and I'm just going to show you how you can use contextual view, split screen. I believe most of you guys know this functionality, to where if I go down to HPI, review systems, exam, my assessment plan, and these, I can move these over to the right-hand side for documentation. And selecting the little arrow moves it to the right. Please be careful if you do go out of sequence. If you do want to pull these back or change this, you cannot drag and drop these in a specific order. You have to remove the one and put the next one in line if you do get them out of sequence. And I'm just going to move these to the right. And if you guys do have any questions on this, please let me know. We do have the dragon capability in these. You can free text in here. You can also do your dot phrases in here as well. And these pull in. Once you've added the text within these components, they'll automatically populate into the components of those documents. So you don't need to drag and drop anything in here. Now, if I wanted to pull something from a prior document, I'm going to go up to my documents, review those documents from here. And let's say I want to copy this review system over into here. I could simply just highlight the text. I'm going to hold my control key down, and I can drag and drop this, or I can copy and paste it into this component. Now you notice that when I highlighted the text in the review system, I got that little tag symbol that populated. And I'm going to pull the physical exam and bring it into the tagged area. So this functionality will work as if you are in like diagnostics and you want to tag the impressions that pull it over into the note. You highlight the text, simply select the tag, and now you're going to notice that it's up in your tagged items under this text. You can hover over these and review what you've tagged. So if you have multiple documents that you've tagged, you can see exactly what you've tagged here. And you notice that you have our labs here as well. You can remove these simply by selecting the little X, and it will remove that specific one. Same thing with the labs. If I wanted to remove specific ones before they populate to the note, I can go through these and remove them. Just be careful if you go to close this window that you do not select remove all. It will give you a notification, do you really want to remove it or not? But that's how you can copy and move these over into the contextual view from prior documents. Any question on this functionality? All right. So there's one other thing that you can bring into your text, and for the sake of this, I'm just going to move all these back over for this screen, is that the calculators. And now some providers use these and some don't, but there's multiple different types of calculators in here. And you can just open these up and kind of go through these if you like. I'm going to show you what you can do with the results and stuff. If you find one that you're going to fill out, I'm going to do this one where I know this patient's only 31, but I'm going to pretend like this patient's a little older. And I'm going to select that they are, I'll say they're 72 years old. So they are a female, and their systolic pressure, let's say it's a little on the high side. Diabetes, if they say yes or no, they get the point system. Prior stroke, no, and you're going to notice that we have a 17 for theirs. Now, if you want to reset it, you can simply select reset. If you select copy to clipboard, all you're doing is copying this information, and when you're ready to open up your document, you can paste that into your specific area in that into the documents. And this shows you the little graph here where this patient sits at a 26% chance of a stroke. Any question on that calculator component? All right, so I'm going to show you real quickly on the functionality of everything that we've done so far. I'm going to open up this office visit document, and you're going to notice that my HPI auto-populated, my review of systems did, and I do have my exam sitting over on the left-hand side. To get this into this area, you simply drag and drop it, and it will populate in here. If you should accidentally delete any of these components and you've tagged it, it will just go back over here. And you can also select the undo or Control Z functionality, and you can undo what you've done. So if you do make a mistake, you can always go back and correct it by selecting the undo on it. Now you notice that my labs have pulled into this document here. I did not tag any custom micro. We don't have any on this patient, but you do have the ability to tag it. There'll be that little sales tag symbol. It'll be dithered out if you select on it, and it turns like a Cerner blue, they call it, and it will be tagged into your document. We did not have any chest x-rays or MRIs or anything to show you where you can do your assessment plan and drag and copy it, drag and drop, but it's you highlight that text and you can tag it and then pull it and drop it into here as well. And all these components are free text components. You can use drag in your auto text through these. Any question on documents here? So I did tag, or excuse me, I did the clipboard for the calculator, and I'm just going to use my diagnosis results field to populate that. So I'm going to Control V, and I just pasted that stroke in here. So if you wanted to put in any specific component, you can put these in here for your documentation. And that's how you can actually get those calculator results into your notes. Any questions? So those are the topics that I was asked to kind of go over. Does anybody have any specific questions? I put everybody to sleep.
Would you be able to show us quickly just how to make a simple power plan?
A simple power plan, yes. So let me go to new order entry. Is there a specific power plan that you guys use, or?
One that we use often in the office are EKGs, where you pair an EKG, like performing an EKG task for the medical assistant, and then the read itself.
Do you know which order it is?
The first one there, EKG,
Okay.
yeah.
All right, so I'm going to go up here and select it, and I'm going to select modify. And this one goes to details, and this is are you asking for modifications on these?
Just if you wanted to build your own power plan, how you would.
Okay. Power plans, this is a one-off order. A power plan has that little pizza box. And let me see. Yeah, you guys just have these. So I'm going to go back and I'm going to use this as a power plan. Is there a specific power plan? The EKG was not a power plan. You want me to use this one, for example?
Sure. I was just wondering if I personally had the ability to create a power plan.
Oh, for a specific power plan?
Yeah.
No. Those all go through our power plan committee.
Gotcha.
So if there's one that's very specific that you want, let's just say I'm going to use this upper respiratory one, and you're reviewing this and you want to remove like half of these medications. They're not applicable to this type of power plan. And this is not the best power plan for me to grab, but if you wanted to modify these and make a specific one, you can put in a request for a power plan committee, and they review that and they'll do that. We just did that with our bariatric provider. We had one and he needed a new one, so we just took an old one and copied a lot of stuff out of it and created a new one. So those can be done. They just go through a committee, but you can have them custom. Any other questions? We've got about 10 minutes left. Did we lose Dr. Sharma? I think she was leaving on a meeting, she said this morning. So does anybody else have anything?
The only other question I have is when we get labs back, if we get a CBC result in Message Center and the CMP that we ordered is not back yet, is there a way within that to see that there are still outstanding labs?
Yes. So right here where it says outstanding orders, and that is a good question. If you select on outstanding orders, you'll be able to see everything that's been ordered and what's been completed. And so like if you've ordered like a CBC and it's just been outstanding, or a CBC, you'll see it's been ordered, when it was, and if you click on it, you'll get the details of it and who's ordered those.
Perfect.
Yep. Yeah, I meant to go over that, so that was a good question, so thank you for that. Any other questions? All right, so if anybody does not have any other questions here, if you do want any other specific one-on-one training, let Emily know. I do know I had a provider yesterday that a lot of this new functionality was new to them, and so they're going to sit down with me and go over some specific one-on-one training, because they use the table of contents quite a bit and versus the M pages. So if you are interested in any specific training, please reach out to Emily and we can coordinate something with that. And Dr. Boone, I think you and I have already talked, and we'll connect on some Dragon training for you. And that also includes like if you guys need help with auto text and stuff. So
that would be great.
I could barely hear you, Dr. Boone. You want to turn your headset, your mic down. Your mic's turned up. You want to flip that mic down. There you go.
Yeah. Yeah, thank you. Yeah, we'll set that up. Thank you.
Mm-hmm.
Yeah.
But does anybody else have any questions? If not, I'll go ahead and stop the recording.